Let's dive right in. Navigating healthcare costs, it can really feel like being dropped in the deep end, no map. And today we're tackling, well, one of the most complex bits, intensive care unit billing, ICU billing. We've got this stack of material you sent over. It's a mix, really. Articles, some research bits, even notes from a podcast, lifelines by Supreme Medic. And while they touch on things like quality, accreditation, you see names like JCI, NABH. The real meat here seems to be the ICU costs. Specifically, how do you even begin to understand a bill like that?
And that's exactly it. That's our mission for this deep dive. We want to use this info to help you get a handle on what you might be seeing on an ICU bill, why it gets so expensive, and maybe most importantly, the practical steps you can take. How to approach the billing process feeling a bit more informed, a bit more empowered, especially during such a stressful time. Think of it as a shortcut through the confusion based on these sources you shared.
Okay, good. So let's start unpacking this stack then. One of the first things that jumps out from this material is why ICU care is just so much more expensive. What makes it so fundamentally different from, say, a regular hospital room?
Yeah, and what's really interesting is how all the sources seem to zero in on the sheer intensity of the ICU environment.
Intensity, how so?
Well, it's not just the bed, right? It's packed with advanced specialized equipment, constant monitoring. But maybe the biggest thing mentioned again and again in these sources is the staffing.
The staffing.
Yeah, you've got a much, much higher nurse-to-patient ratio. Often it's 1-to-1, maybe 1-to-2.
Wow.
Which means continuous, really vigilant support for patients who are critically ill. It's that intense level of human resources, plus the tech. That's what sets it apart.
Okay, so that constant high-level attention, the technology keeping someone stable, that makes sense. How does that intensity translate onto the actual bill? What are the typical line items we'd expect to see?
Right. So based on these sources you've provided, the bill gets broken down into several key parts that reflect those resources. First, you'll definitely see daily bed charges.
Okay, the basic room cost.
Exactly. It's the base cost for occupying that specialized ICU space. And the material notes these are significantly higher than a general ward bed, partially because it includes the availability of that specialized nursing care sort of baked in.
Got it. What else?
Then there's the cost of specialized equipment and monitoring. Think ventilators, cardiac monitors, infusion pumps, all that critical life support tech. These devices are expensive to own, maintain, operate, and that cost gets passed on.
Right.
Related to that, but sometimes broken out separately, is the critical care nursing support.
Wait, didn't you say nursing was part of the bed charge?
Some of it often is, yeah. But the sheer volume and the high level of specialization needed from ICU nurses means that sometimes that cost, or parts of it, might appear as a separate line item, or it just heavily influences that daily rate, making it much higher.
Okay, I see.
And definitely don't forget doctor and specialist charges. The ICU doctor, the intensivist managing the patient's overall care.
Right.
Plus, any other specialists they need to call in, cardiologists, kidney specialists, whoever. Those are usually billed separately by the doctors themselves, not the hospital per se.
Okay, that's another layer.
Then a big one, medications and treatments. ICU patients often need a complex mix of drugs, maybe blood products, special IV fluids. And the sources really highlight that even the small stuff, the consumables.
Like what?
Gloves, syringes, tubing, IV bags. All those disposable items, they add up incredibly fast.
I can imagine.
And investigations and tests, another constant. Daily blood work, x-rays, ECGs, maybe CT scans. These often get repeated multiple times a day to track how the patient's doing.
Each one has a charge, presumably.
Every single one. And finally, you might see other charges. Things like ancillary services, maybe some administrative fees tacked on.
Wow, okay. That is quite a list. It's definitely not simple. The material also brings up something interesting, a distinction between ICU bed charges and critical care charges. That sounds a bit like splitting hairs. Or is there a real difference?
No, that's actually a really important clarification that comes up in the sources. The daily bed charge, like we said, is basically the cost for the room, the physical space, the basic setup, the available resources like baseline nursing.
Okay.
But the critical care charges, the sources note these are specifically for the actual hands-on medical services and the intensive monitoring provided to the patient.
Ah, the active stuff.
Exactly. And one source even mentioned, citing Science Direct, I think, that this part can sometimes be billed based on time spent and the complexity of the care.
I see.
So it's separating the cost of the specialized place from the cost of the high-level work being done in that place.
Okay, that makes more sense now. So it's definitely not just one flat rate. It's a sum of many, many parts. Beyond those specific line items, what other big factors did the sources say influence the total bill someone might end up with?
Yeah, the sources identified a few key variables. First, the type of hospital.
Right, private versus public.
Exactly. Private hospitals, corporate hospitals, they generally have higher charges than, say, government or public facilities, just different overheads and structures.
Makes sense.
Then the severity of the illness. This is critical. A sicker patient just requires more complex procedures, more intensive monitoring, maybe more expensive drugs or interventions. All that drives the cost up.
Naturally.
Duration of stay, obviously, is huge. It's pretty straightforward. The longer you're in the ICU, the more all those daily charges pile up.
Day after day, yeah.
And finally, individualized treatment needs. Every patient is different. The specific combination of treatments, the specific drugs, the procedures they need, that unique mix will tailor their final bill.
And the sources actually gave some numbers, right?
Yeah.
Specifically for India, which helps make this less abstract. What kind of figures are we talking about?
Yes, and the numbers are quite striking. The material indicates that daily ICU bed charges in private hospitals, they can easily be in the range of $20,000 to $25,000 per day.
Just for the bed charge, basically.
Well, the baseline daily charge, yeah. And then for the most intensive situations, like needing a ventilator bed in a large private hospital, the costs can really shoot up. Potentially 1 lakh to even 1.5 lakh per day.
1.5 lakh rupees a day.
Yeah. And the sources cite findings, I think, from the NIH mentioning that these kinds of typical ICU stays can, sadly, push families into real financial hardship.
I believe it.
What's also eye-opening is just the sheer range. The sources compared different facility types. Government hospitals might be, say, $500 to $3,000 a day.
Okay.
Private hospitals maybe $5,000 to $25,000 plus. And those big corporate hospitals could be anywhere from $20,000 up to that $1,000 plus figure. It's a massive spread.
That range is incredible. And it really hammers home why understanding these bills is just so vital, especially when you're already dealing with a crisis.
Yeah.
So, okay, for someone facing this, maybe looking at an ICU bill or anticipating one, how do the sources suggest they even begin to make sense of it? How do you navigate this?
This is where the material gets really practical, really helpful. It essentially boils down to being proactive and seeking clarity. First, the sources strongly advise. Review carefully.
Just look at it closely.
Yeah. When you have the capacity, take the time to actually look at each line item, each charge listed on the bill.
Okay.
Second, ask questions. Don't ever feel hesitant about this. Contact the hospital billing department or your insurance provider if anything looks unclear or you think it might be wrong.
Mm-hmm.
The material actually emphasizes that hospitals are usually quite willing to explain things and, importantly, correct errors if they're found.
That's good to know.
Third, and this is huge, understand your insurance. Know your plan. What are your deductibles? What's your coinsurance? What does your policy actually say about critical care coverage?
Right, the fine print.
Exactly. One source specifically says, check your coverage before admission if possible, or as soon as you can afterwards, and ask the hospital to help verify what insurance will cover versus what you'll likely pay out of pocket.
Proactive is key there.
Definitely. And interestingly, they also mentioned negotiation.
Really? You can negotiate a hospital bill?
Well, one source suggests that in some situations, especially if you find clear inaccuracies or errors, it might be possible to discuss or negotiate certain aspects of the bill. Worth asking, perhaps.
Huh. Okay. Now, that Lifelines by Supreme Ethic podcast excerpt you mentioned that had some really specific do's and what to ask, those felt super actionable. Can you walk us through those?
Absolutely, yeah. That section is gold. The key do's they list include, first, just accepting upfront that ICU care is expensive. Mentally prepare for that.
Right.
Be prepared for costs to change, to go up or down based on the patient's condition. It's not static.
Right.
And critically, ask for a cost breakdown early on. They specifically recommend requesting a detailed cost estimate near the beginning of the stay.
An estimate.
And then get updated billing information regularly. Don't just wait for a massive bill at the very end. Ask for updates.
Okay, that makes sense. And the what to ask.
This is where they get really granular, really specific. Do ask for a daily breakdown of charges, room, nursing, meds, tests, any specific equipment being used that day.
Daily breakdown, got it.
Do ask for itemized list of services and their individual costs. Clarify things like, is every IV drip charged?
Right.
Every monitoring session. How is ventilator use charged?
Right, the specifics.
Do inquire about any additional charges beyond that basic daily rate, like those specialist consults we talked about, or maybe particularly high-cost medications. And for equipment, do ask. Is it included in the daily rate, or is it billed separately? And clarify if there's a different charge for short-term versus long-term use of something like a ventilator.
Good questions. What about the insurance and payment side of things?
They really hammer this home again. Verify your coverage before or right after admission. Check for any specific critical care terms or exclusions in your policy.
Don't assume.
Exactly. Do work directly with the hospital's billing department. Ask them to verify your insurance benefits and give you the clearest possible picture of your estimated out-of-pocket costs.
Okay.
And if you're worried about affording it, do ask if the hospital has financial counselors. Inquire about any options they might have. Flexible payment plans, installment options, potential discounts, or even financial assistance programs.
Good to know those might exist.
Definitely worth asking.
Now, handling unexpected charges, that sounds like a common fear. How do the sources suggest dealing with a bill that seems off or way higher than expected?
Yeah, they tackle this directly. The advice is, do be proactive. If a bill seems too high, or if parts of it are just confusing, don't ignore it.
Speak up.
Yes. Review it carefully, item by item. Make sure the charges seem to match the services you know were provided. If anything is vague, do ask for a more detailed breakdown of that specific charge.
Okay.
If you genuinely believe there are errors or discrepancies, do communicate clearly with the billing department to get them corrected.
And keep records.
Absolutely crucial. Do keep meticulous records of every single communication you have about billing questions or disputes. Dates, times, who you spoke with, what was said. Document everything.
That sounds like solid advice. The sources also had some really smart, direct questions to ask the billing team, didn't they?
Yes, these are great for cutting through the confusion. Are nursing charges or equipment charges separate from the main bed charge?
Good one.
Can I please see an itemized bill each day, or maybe every few days?
Okay.
Is the charge for the ventilator a fixed daily rate, or is it charged per hour?
Details matter.
I noticed some tests seem to be repeated frequently. Can we just verify the ongoing need for all of them?
Polite but direct.
Which items on this bill might be refundable if they were prepared but ultimately unused? Like specific expensive medications, perhaps?
Interesting.
Is it possible for me to use an outside pharmacy or lab if the cost might be lower? Or does hospital policy prevent that?
Worth asking. These questions really empower you to seek that clarity.
Exactly.
So on the flip side, what about things to actively avoid doing? What are the common mistakes the material warns against?
Right, the pitfalls. First, don't ignore unexplained charges. If something looks weird, question it. Don't just pay it.
Okay.
Don't pay large sums of money up front, like advances, without getting a clear written breakdown of exactly what that money covers and how it will be applied.
Get it in writing.
Yes. Don't assume all ICU beds cost the same, even within the same hospital. Different levels of care, different equipment, rates can vary. Always ask for the specific rate for that bed. Don't overlook the consumables. The sources really stress this. The small items, gloves, gauze, syringes, they can add up to a surprisingly large amount. Pay attention to them on the bill.
Right. The little things add up.
And a really big one. Don't just assume your insurance covers everything when it comes to critical care. Always, always verify pre-authorizations, check your policy details, look for exclusions related to ICU stays.
Double check everything. That's incredibly practical advice. And did they mention a simple tech tip too?
Yeah, a straightforward but smart one.
Yeah.
Use some kind of health expense tracker app on your phone, or even just keep a dedicated notebook.
Just a log thing.
Exactly. Keep a running record of charges as you get bills or updates, log payments you make, and note down all those communications you have with billing or insurance.
Why is that so helpful?
It can be invaluable later on for submitting insurance claims, tracking reimbursements, maybe even for tax deductions if applicable. Just having an organized record helps manage it all.
Okay. So, pulling all of this together, from understanding the why of the high cost to the what on the bill to the how of questioning it, what's the real core message coming through from these sources you looked at?
I think it really boils down to transparency and advocacy. One source had a line that stuck with me. In the ICU, you deserve transparency just as much as compassion.
That's powerful.
It is, and it frames it well. Navigating the bill in this intense situation, it isn't about being difficult or mistrustful. It's about being an informed, responsible advocate for your loved one. Managing not just the medical side of things, but the financial side too, as best as you possibly can during that time.
So the takeaway is,
Ask questions, seek clarity, document everything, be proactive. That seems to be the consistent advice.
we've definitely taken a deep dive today into the, let's face it, often overwhelming world of ICU billing, drawing directly from the insights and the sources you shared. And it's become really clear that understanding these costs involves knowing what actually makes up the bill, the big factors that drive the total cost up or down, and crucially, the proactive steps you can actually take to gain clarity and manage the financial side during what's already such a challenging time.
You know, this whole discussion raises a really important question, something for you, the listener, to maybe consider. If navigating something as fundamental as a critical care bill requires this level of significant personal effort, this much diligence, all these specific questions from patients and families,
Yeah.
what does that really tell us about the current state of transparency in healthcare pricing more broadly?
Mhm.
And maybe what collective role could patients, families, advocates play in pushing for a system where costs are just clearer, more understandable right from the start? It's definitely something worth mulling over.
That's a great point to end on. Thanks for joining us for this deep dive. We genuinely hope this exploration helps you feel even a little more prepared, a bit more equipped, if you ever face the need to understand complex healthcare bills like those for ICU care.